Everybody to the April meeting of Health in Hackney. I've had apologies for absence from Councillor Canley. I understand that Councillor Adams will be slightly late joining us online, as will Councillor Turbet-Delof. I'm here in the chamber with the members being Councillor Samatar and Councillor Patrick for the members of the Commission. Just a brief matters of housekeeping. It's hybrid meeting. Please keep your cameras on. Please keep your microphones off unless it's your item. Please don't start conversations in the chat. Please raise your hand if you wish to ask a question. Members of the press may be watching. We are being live streamed. This is being recorded. Declarations of interest. I understand I have one from Councillor Samatar. Councillor Samatar, if you can just use your microphone, please.
Thank you, Chair. I am a Wellbeing Network Coordinator for City and Hackney Mind.
Thank you. And I don't think I've been notified of any other declarations. So with that, then I'm going to move on to the first substantive item on the agenda, which we've got half an hour for. This is an update on the Integrated Mental Health Network. Welcome to Jennifer Millmore and Andrew Chatham, who are both public health consultants at the London Borough of Hackney, and also Vanessa Mossis, who is the chief exec of Mind in City and Hackney, who have been commissioned for the Wellbeing Network that we're going to hear about. Just to remind everybody, this item was before us in September, I think at an earlier stage before the commission or the contract has been awarded or re-awarded to Mind at that stage. And the understanding was, as we can see from our succinct and helpful thank you presentation in our agenda, to try and meet higher need with the new Wellbeing Network. And so we're looking forward to sort of hearing some specifics and understanding how it is meeting that higher level of need. Could I maybe ask either Jennifer or Andrew maybe to start off sort of for under 5 minutes sort of presentation, and then I'll maybe bring Vanessa in and then open it up for questions. So Jennifer and or Andrew, please.
Yep, sure. So very quickly, just to say that we've awarded the contract, as you mentioned, to Mind as the lead provider, and I'll list you the subcontractors, as I think they all deserve a mention. So it's African Community School, Bika Halim, Centre for Better Arts, Centre for Better Health, Core Arts, Derman, Hackney Chinese Community Services, Immediate Theatre, Irie Mind, CIC, Rainbow Mind, and Shoreditch Trust. And congratulations to all of them for a really strong bid. We were really impressed and happy to be working with them going forwards. As you all know from before, so I won't go into it in a lot of detail, but the new service is going to be a very holistic and person-centred service based in our local communities, taking a person-centred approach. As you mentioned, we're focusing on those residents with complex mental health needs, and we'll be working very closely with other partners in the mental health sector. The only other thing for me is just to say that we have already, or the service has agreed that it will continue to be called the Wellbeing Network. I know that was one discussion point. Vanessa, I don't know if you want to add anything to that.
Yes, so I think that describes the outline of what the service does. So what I will just highlight is some of the innovations of the new service. We will have a central integrated wellbeing team, which will be run by 7 of the different partner organisations to ensure that there is integration for clients from start to end of the service. We will be innovating to support people with cost of living crisis. So, and obviously as partners, we have a range of different services that can support people experiencing poverty or economic stress. But we will have as part of the partnership employment and vocational support and training as well, as peer support for people who are having challenges of employment. We will also have what's known as a Mind Forward model, which is a first in this country as far as we are aware. We are working with Professor Wendy Dryden to innovate for single session therapy. And what this is it's a proven method for supporting people to address issues as quickly as possible, with the idea of getting an outcome in one session. And the idea is that supports people who might have challenges with engaging, which is quite consistent with the more complex population group. We will also be holding safe spaces, working closely with ELFT, our NHS partners, to ensure that anyone who feels that they have risks around their mental health can receive support anywhere in our neighbourhoods as rapidly as possible. We will also be supporting the wider voluntary sector to contribute to providing mental health interventions for a range of minoritised groups, and supporting people to open access sessions, so being able to do anything that supports their well-being in the local community as supported by our wider and vibrant voluntary sector.
Thanks, everyone. So if I can just think of Andrew, did you want to say anything, or sort of had it been covered before I go into questions?
No, that's covered. Thank you very much.
Thanks. So just one sort of just understanding question, and then I've got a follow up. Just so, can you just explain in terms of pathways why? I appreciate there's a safe self-referral mechanism here, but just say it was via the GP. Under what sort of circumstances would a GP refer a patient to the Wellbeing Network over IAPT? And just to sort of understand how that breaks down. And then I suppose the sort of the bigger sort of more strategic question is just really trying to understand the focus on the complex needs. I mean, I appreciate Vanessa said there about the forward model that might be more attuned to those with more complex needs, but sort of that cohort of individual that may be teetering on the brink of needing East London Foundation Trust sort of inpatient help, and how we keep that, or indeed step down from that level, or how we prevent people from escalating up to that level. How is this contract or this commission now designed to support that much higher level of need?
Jenny, would you like me to take that?
Yeah, I was going to say, I think that could be either of us, but I'll let you go ahead and I'll add anything if
Yes, certainly. So shared care will be a critical element of the new contract. So working with, for example, GPs and with ELFT and from other partners, for example, social prescribers, to understand where the client is needs are best served from the outset. So it could be, for example, that someone comes to the Wellbeing Network for an initial period of support for stabilisation before they access IAPT, or that they could go to IAPT directly. 3 of the Wellbeing Network partners are part of the Psychological Therapies Alliance that provides IAPT services. So we already have a very, very close and well-established relationship with NHS Talking Therapies in City and Hackney. So being able to navigate the correct support as quickly as possible should be very straightforward. But then there's the opportunity for people to access wider support if necessary, subsequent to an IAPT intervention. Within the integrated wellbeing team as well, we have a partnership manager who ensures that through regular engagement with other teams in the community, that referrals are as precise as possible, and we resolve any issues around pathway ambiguity as quickly as possible.
So Vanessa, just on that point, as I understand it, there's no hierarchy of Wellbeing Network versus IAPT. It's a question of what best meets the needs of a particular client.
Yes, because it could be varied over time. However, there are referral criteria, and there's kind of 3 levels of referral criteria within the new network. One is around complexity of need, and clinically how we categorize that is through moderate or severe anxiety and depression, and we also use a clinical rating scale for personality disorder, not because we are screening for personality disorder, but because it is an effective proxy for complexity of circumstances and potential challenges with being able to be a treatment adherent. Secondly, there is kind of around other needs in someone's life. So it could be that they're unable to access a more primary care-based intervention because of other life circumstances, for example, employment or family circumstances. And then thirdly, you've got the criteria in relation to health inequalities.
In terms of my, Jennifer, did you want to come into that point before we sort of go on to my other question about the complexity?
Sure. Yeah, I was just going to also add that we're working with NHS partners as well around sort of a no wrong door approach in our mental health services. So on one side, we're working with or potential referring partners that we can identify, helping them to understand which service would be most appropriate. But if people do come to the wrong service, if that's the right way of putting it, the one that's maybe not most appropriate for their needs, that service will then help them to, as smoothly as possible, access the right service. And that's something that together we're working on, which hopefully will simplify that bit too.
And then in terms of my sort of other question, Vanessa or Jennifer, in terms of the much more complex need, but not yet bordering on needing East London Foundation Trust sort of inpatient care, and this being a stated objective to want to deal with more complex needs, how are we seeking to achieve that?
So that's both through partnership, ensuring that people have the opportunity to access services as quickly as possible. People with complex needs often don't ask for help as straightforwardly as they could do. It's also it's recognizing that complexity is about circumstances rather than necessarily just people's presentations. So it's really thinking about a holistic service offer, both through the shared care and partnership with other partners, but in terms of the nature of the partnership itself, making sure that diversity, both in terms of meeting people's identity-based needs, but also encouraging people to access and think more carefully about their strengths through the breadth of the service offer, is a really good way of just supporting and enhancing strengths and engagement. City and Hackney have the highest level of severe and enduring mental health needs in the country, and that can be, a whole range of factors that feed into that. And so a really holistic service offer is extremely important in being able to address those needs.
I've probably got a follow up there, but I'll leave it to, I want to open it up to members. So do any members have any questions? Cllr Patrick?
Yes, in your presentation you talk about ensuring that the service meets the needs of all the Hackney population. Just wondered how you're going to achieve that. I can see you've got a variety of providers, but how, we know that people don't always come forward. So how are you going to ensure that perhaps people who are underrepresented in the service at the moment are going to come forward and get the service that they need? And also the KPIs. I wondered, talk about the KPIs. So I assume the commissioners have drawn up the KPIs, and I wonder what the KPIs were. And you said you talk about well-being and people attending training. So is it about the KPIs that relate to the individuals or the service, how the service works? I just want a bit more information. And I assume, and how, once people are in the service, can they stay in the service as long as they think they need the service, or do they get discharged from the service?
I'm happy to take that, Jenny, as an outset. So just coming to your last question around staying in the service, we're expecting the average length of the service will be 1 year in terms of intensive support. However, we are investing in embedding and expanding peer support, and as has been the case for the Wellbeing Network for the last few years, actually really developing those pathways so that people know that they can come back when they need to do so, but also that they've got in touch with their strengths and their resilience and can offer that support to other people. So often people feel like just having a little bit of a top-up support, for example, a yearly MOT, just, how am I doing with my recovery techniques, etc., can be really supportive of enhancing and maintaining that recovery. And there will be no time limit in terms of the people's ability to access peer support. So your first question was in relation to people who might find it hard to access services and people who might be minoritised or have health inequalities. And this is an area that has been traditionally a source of strength for the network, in that we have been able to really do well both in access and outcomes for people who come from minoritized communities or have other aspects around barriers of accessing NHS and other standardized healthcare. And we intend for that to continue. And that's in part about how the partners are engaged, but it's also about the diversity of the service offer, but it's also about our accountability to our local community to constantly evolve our forms of support that we offer people. And certainly in terms of the existing network, we're very proud that we achieve our best clinical and non-clinical outcomes for people who usually experience the highest level of health inequalities. Jenny, do you want to speak to the KPIs?
Sure, sorry, just keyboard stopped working. Yeah, absolutely. I'd be happy to share the KPIs with the group if rather I can read them all out. But they're a mixture and measure sort of simple things like the number of people in the service, as well as the actual outcomes and improvement in terms of mental health. We've got one in there around partnership working, because actually that's really key to making the service work in terms of joined up care with our partners, rather than kind of thinking inwardly. And also there is actually a KPI in there about making sure the service is representative of the whole population. So hopefully that is one way in which we will cover that, and that's quite a complicated KPI. As I said, happy to share the detail that they've already been published in the paper that went to CPIC, so that they're not anything we can't share. So happy to do that. And yeah, I also say, I know Vanessa, your team have been working really hard on a communications campaign to make sure actually we really do get the word out about the new service, both to the public, but also possibly even more importantly to partners. So for example, those working with our more vulnerable residents actually know of the service and can help to signpost them.
If I could just add to that, then, I mean, certainly the service in terms of the design and the principles of how the model of care, we take a very strong intersectional approach. So we understand that people are more than just different aspects of their identity. And this alongside a trauma-informed approach is a good way of supporting people to be able to access services in a way that feels like they're in control of their access to the service. Also, as partners, we have always taken a very strong approach to anti-stigma work and working very carefully around discrimination. For example, Dermot has done some very solid work in relation to suicide prevention in the Turkish Kurdish community, and really continuing to support the entire community to understand that mental health is something that we all have. Mental ill health is something that we are all at risk of, but we can all do things to enhance our mental health, and that there is no shame in seeking support if you're challenged with your mental health.
Thanks. I'll check Councillor. I see you've got your hand up. Cllr Adebayo first.
Thank you so much, Vanessa. You've just answered some of my questions there. That mental health is what everyone has, and it's how we undo and deal with it. You mentioned something earlier on that the resident that City and Hackney has the highest numbers of mental health in the country. Did I get that right?
Yes, you did.
Okay. And I wonder whether because people are being encouraged to come forward and talk about their mental health, maybe that might contribute to why we have that high number. Because in some community, mental health is a taboo where it's no go. Nobody is allowed to talk about it. People are ashamed to talk about it. In that sense, people don't come forward. Maybe in Hackney, we are encouraging people to come forward. And at the same time, how do we bridge the gap?
Yes. So I think the range of reasons why Hackney has such a high level of mental illness and has done for decades are complex. Poverty is the overriding factor. Areas of the country that have the highest rates of poverty have the highest rates of mental illness. Also urban areas and areas with high levels of pollution, kind of environmental factors are all contributing factors, as well as racism and other forms of discrimination. I think being able to talk about it makes it a lot easier, and certainly our GPs do very well at supporting people to access talking therapies in relation, in comparison to other areas where we have high levels of poverty. So the prescription of antidepressants is much lower in City and Hackney than other comparable areas. So I think we're performing well in that respect, although we still have some parts of the community where levels of access for talking therapies are lower, notably the Black African community. And so there's still much work to be done there. And that's why we've brought on both the African Community School, who've been a very strong part of the Growing Minds programme, and iRemind.
Thank you.
Thanks, Vanessa. Cllr Turbet-Delof. Claudia, you're breaking up a bit. Do you want to try again?
Yeah.
We're still, I'm afraid, you're breaking up quite a lot. We're hardly catching anything.
Log off and log on.
Yeah, so maybe try logging off and logging back in again. And if not, maybe if you could maybe email a question or phone in or email a question to Richard Jarlath and we can get it that way. While we're doing that, if I go back to Cllr Samatar, hasn't asked, then I'll come to Cllr Patrick.
Thank you, Chair. Vanessa, I just wanted to quickly come in and ask the idea that when you especially said about mental illness doesn't look the same for everyone, and the support that we're looking in terms of trauma-informed and the amazing work that goes into that sounds brilliant. But I wanted to ask how we can encourage, and what has been done actually, to encourage people who don't have the mental capacity to go out of their way to seek help. And that might lead with the adult social care kind of conversation as well, of how we're supporting people who are truly vulnerable in Hackney.
Thanks. Well, I think the first thing is really around identification, and with people who are particularly vulnerable, it is extremely important that the entire community feel like they have a level of mental health literacy to be able to identify and respond effectively mental health first aid to people who may feel like accessing support is something that they don't have the capacity to do. Also, I mean, I think peer support is really critical there. I mean, everyone has the right to friendship and connection, and the more that we can do to support people to access wider things within their community, even if they feel like they're not in a position to access formal mental health support, then it creates that kind of pathway to support. And I think that also speaks to the importance of us as a wider community understanding what it takes to be trauma informed and to be able to support each other with loving kindness. I mean, we talk about clinical things, but actually it's really about being able to speak and act with kindness to each other.
Jennifer, did you want to come in there?
Yeah, I was just going to add, kind of building on what Vanessa says, beyond the Wellbeing Network as well, in public health, it's something that we're working on and trying to work with other local organisations on, is just making mental health everyone's responsibility, and that actually everyone, both organisations and services as well as individually, we all have a responsibility for our own mental health and those that are around us as well. It's not all about just sending people to services, which I know everyone here will know, but that's often the sort of typical response we get, what mental health services are available, which actually there's so much we can do in the design of our services as well as the way we all look out for each other that can really make a difference to mental health. So that's something that we are separately also addressing in public health, I thought worth mentioning.
Thank you. Cllr Patrick.
Thank you. You talked about poverty in your presentation, and also when the volunteer sector came to us and talked about the Together the Better project. They talked about service users having much needs, higher needs of hunger, housing, eviction, and debt. I know that every service in Hackney that does advice work is overrun by people needing help with getting benefits and advice. And I just wondered how you talk about helping people with those things, because obviously hunger and the lack of money and poor housing obviously affect people's mental health. I just wondered, do you do the work yourselves, or do you pass people on to other services? And if so, there's obviously a waiting time, and how that affects people not getting any better of their their health, if their house is not getting any better, or they're still in debt, or they're not getting their benefits. And also, you know, I wonder whether you've come across any more, whether your services come across more need because of what COVID and size, although COVID is not over, but it's in a new phase. I think there's a new, it might get worse again soon, but obviously that created a different aspect of need, and lots of people also we've realised how many people are in social isolation, and I wonder what effect that all has on the service and people coming forward, if it has.
Yes, so within the relationship between mental health and poverty has always been complex, and it's been two-way. And it's certainly true that people who experience mental health difficulties are more likely to be in poverty. Money worries obviously have an impact on people's mental well-being. And we are very fortunate as a Wellbeing Network that several of the partners are also partners on the advice network, and so as partners we are able to refer onwards into our own services and be able to hold shared care effectively within the network and the wider service offer of the partners in order to support people effectively with their mental health and issues around money. We're also able, working in partnership with our national mind, to work very directly with government and the DWP in order to be able to support campaigning around improved support for people with mental health needs who are also claiming benefits. Accessing support when you are in poverty carries a lot of associations with shame, and so the work around reducing stigma, but also just providing open access, flexible access to services is extremely important to get people through the door, which is part of the reason why we started developing the Mind Forward model. So because we know sometimes you only get one shot to speak with someone if they are absolutely desperate, and we are seeing a lot of people at the moment who are absolutely desperate. One of the other things as an innovation of the service is IAPT preparation. So people may move into the IAPT NHS talking therapy services for therapeutic support, but be held by us for financial support or vocational support or support to retain employment. And internally as teams, we have strong networks and partnerships that enable the frontline staff within the Wellbeing Network both to access support and advice and consultancy from our advice workers, but also to be part of that wider network who can effectively be skilled to do brief advice and support so people know how to access benefits and they will understand their entitlement, and sort of do those early stages so that our advice services are there specifically for people who have not been able to gain the benefits in which they're entitled to, doing the appeals process for the DWP, etc. We're also fortunate as a network to have a good relationship with the DWP in order to be able to support their understanding of mental health needs and how they can support addressing and be kind and compassionate in supporting job seekers, but making sure people are upskilled and that we are reducing shame is a key part of it, because the issues around poverty aren't going to decrease for the time being, and it is a really critical factor affecting our community's well-being.
Thanks, Vanessa. Councillor Adebayo wanted to follow up, and then I'm going to bring Cllr Turbet-Delof in. Councillor Adebayo.
Thank you. And Vanessa, I'm coming back again because you did mention that you refer to IAPT from your service. I just want, what of those residents that has language barrier? Because now it is two different sections or two different things, having emotional support and therapy. So I'm not sure whether IAPT in Hackney supports residents who has language barrier with cultural appropriate counseling. Any idea?
So we are very fortunate within City and Hackney to have a Psychological Therapies Alliance. So there are 4 different providers of IAPT services, 3 of whom are the voluntary sector partners within the Wellbeing Network, who deliver in Yiddish, Derman, who deliver in Turkish and Kurdish, and mind, and we have a range of different community languages, particularly focused on African diaspora languages. So in terms of just an IAPT intervention, there is a good range of coverage so that people can access that intervention by people who come from the same background, can speak the same language, and have a strong understanding of those kind of wider cultural needs. There's also access to the standard things like, for example, language line. But both with the IAPT services and the psychological therapies, both group and one-to-one, that are delivered within the Wellbeing Network, they are specifically designed and delivered by people with lived experience. And so there's interventions that, for example, with iRemind, we deliver acceptance and commitment therapy for racial trauma within the new Wellbeing Network, and we've been developing that in partnership with Johns Hopkins University in America. So that's a specific designed intervention for Black communities. We will be working in partnership with the African Community School in order to be able to deliver that as well. So really starting to fuse, again, working in an intersectional way so that people both have that access to the mainstream services, but where there are those language barriers or the cultural or stigma barriers, that we are able to effectively address them and continue to evolve and innovate in how we do so.
Thanks, Vanessa. And we're running out of time for this item. Cllr Turbet-Delof has actually joined us in the chamber. So do you want to fire away with the question we couldn't hear before?
Thank you so much, Chair. Apologies about earlier. I just wanted to thank you. It's been really helpful. I've been listening in. I wanted to check about the forward model, which is for people that have limited time. And as a therapist, I'm really glad to see this because it's definitely a model that I would imagine will work. What happens afterward? What's the outcome after that one session? What do patients or clients will have perhaps as an action plan or referrals? Or yes, that would be really helpful to understand. Thank you.
So it's super flexible. Now, someone might have actually achieved their outcome through that. Job done, which is fantastic, or it could be an onward referral, or it could be that we give the person the opportunity to access another part of the network. So it's really flexible in that respect. The idea is to ensure that people can engage as quickly as possible and have confidence in the service and their ability to change their living circumstances. Also within the model, we will be using it as a kind of a clinical consultancy model. So within the wider network, all the staff and all the partner organisations will have opportunity for kind of gold standard kind of clinical consultancy via the Mind Clinical team. So the kind of the quality of all the interventions should be better as a result of that.
Thanks, Vanessa. I think I'm going to have to wrap this item up. Just going back to sort of the strand of question that I was asking about. I suppose my concern is coming from this. Is there an unmet need bracket that is more serious for a client group, that is more serious than your service can provide for, but that falls below East London Foundation Trust and say their community support bracket? I mean, do you keep, is there monitoring going on, the regular conversations you have with East London Foundation Trust of people that you would want to get greater community support from them, but that they don't feel that falls within their thresholds? I mean, is there a risk? And do we know, because are we collecting that data to understand?
Yes, we are collecting that data, and we have very regular both strategic and operational discussions with ELFT about potential for unmet need. Now, within the ELFT community neighbourhood teams, there are the community connectors, which are run by the Wellbeing Network. So we have that kind of web of relationships, and so we can understand and get community intelligence around rising need. We also have a very strong relationship, Wellbeing Network partners, with the ELFT crisis pathway, and we've been supporting the redevelopment of that crisis pathway, so we can flow people through who aren't eligible for the neighbourhood mental health teams to wider, both the Wellbeing Network and our wider services, but also wider community partners. And there's certainly been times working over the last couple of years where we've worked together to design specific interventions where we know that there is an emerging unmet need, particularly in relation to crisis intervention. And that working relationship, the quality of those working relationships, the openness, as well as having really good quality data and being humble about what we don't know, I think is a really critical ingredient to evolving and addressing unmet need.
And if we give you the last word.
Yeah, just very quickly to add to that point, we also design the service with a certain amount of flexibility in terms of the budget, how it's allocated. So using that data where we do identify unmet need, we can actually shift around a bit of the budget to try and make sure that that is met. So it's not kind of as it is forever if we do identify a gap, which is quite important.
Thank you, everyone. I'm going to have to draw this item to a close because we've got another substantive item on the agenda, but thank you very much. That was fascinating. I think all members thought so as well, and we very much welcome you being recommissioned and for the work that you're doing, Vanessa. And Jennifer, how long does this commission cycle run for? Is it a 4-year cycle?
It's 2 years +1 so potentially up to 4.
Yeah. Okay. All right. Thank you. Well, it may be at some point in the future we may think about sort of a deep dive into a particular area to understand that more, whether that be crisis support or another particular aspect. But thank you very much indeed for your contributions.
Thank you.
I'm now going to move on to the second substantive item on the agenda, which is a discussion in terms of adult social care and housing. We're welcome from Adult Social Care. We're joined by Georgina Diba and Helen Woodland, the Group Director, and also Terry-Ann Eubanks-Thewell, who's the Head of Service. From Climate, Homes and Economy, we're welcome in the Chamber. We're joined by Stephen Haynes and James Goddard. And from Finance, we're joined by Chris Pritchard. Thank you, everybody. Just to very briefly set the scene on this, this sort of stems from comments and thoughts that have been made over sort of the last 6 months as to the adult social care budget and the number of people that are placed in residential or nursing care out of borough, which is a significant number, and the costs of that, and particularly the hotelling element of that, that if they were dealt with, say, in a in-borough solution that wasn't 100% residential or nursing, that amount could possibly be reclaimed by the council, and then that could be a significant saving. And then that sort of sparked the question and the debate as to if that financial case does stack up, are there ways to explore whether more could be done in borough to possibly provide that form of accommodation. To be clear, this isn't the intention of this piece is in no way to, understand we've got 2 or 3 teams here that are hard pressed on stretch targets as it is already. This is in no way to sort of be critical as to why hasn't this been done before. It's very much, is it something that could be looked at in the future? Does it stack up both on the adult social care side? Are the genuinely the numbers that could be dealt with in this accommodation, and does it stack up in any way on the housing regen side with their priorities and financially? So we're looking at it in a blue skies, forward-thinking approach. First of all, can I ask, I think Georgina, unless Helen wanted to do an introduction, Georgina to kick off with her presentation, which I think we found very helpful, setting out the main points. I suppose the one thing, if I can sort of try and tease out with you in the introduction, which I think Helen has maybe previously alluded to, is how many of those, if we take the residential and nursing care, 450, 460 people that are currently in those care settings, roughly what do you think? I know more work would need to be done, but how many of those what will be a case of how many could possibly be dealt with in another setting in borough, just to give us some sort of idea as to the financial envelope we could be talking about. But I appreciate it's a very hard ask, but if you could give us some idea during your presentation. So George, I think unless Helen wants to say anything, Georgina, over to you.
I'll kickstart. That is a very, very hard ask. And I guess my worry would be setting out a number and not being able to achieve that. I think, and we'll talk more about this as we go through, it's really important that we do a really thorough needs analysis of the kind of the current use, the cohort, and which ones we think could could come back into the community. But let me try to manage 3 screens and share this presentation. If you'd give me one moment. So hopefully everyone can see that in full screen. So I'm going to actually just start with the first few slides and then hand over to Helen. And I'm just going to start by giving a little bit around the context of this and the people that we're talking about, as well as some of the national drivers. So just to put it into context, that actually adult social care supports 3,300 individuals a year. That's a 25% increase. And interestingly, from when I wrote these slides or supported on them a few weeks ago, it's gone up to 3,382 people. And the reason I mention that, I think it's actually just important to highlight that number is going up week on week in terms of the demand and people we are supporting. We are the largest budget within the council, and yet we make up in supporting less than 2% of the population. And I guess one point I'd like to just highlight is about who we support, because actually adult social care has a core purpose. It's to help people and their families and with their networks to achieve the outcomes that matter to them. We talk about enhancing their well-being, independence, and importantly, to be safe. And as I mentioned at the bottom of this slide, the Care Act is it's our guiding statutory legislation, and it means we only work with people who have eligible care and support needs. That's often people with a learning disability, who might be mentally unwell, who have long-term conditions or physical disabilities. And it's about that impact of that condition on their ability to undertake activities of daily living. But I guess the one thing to also note, and as a social worker I say this, the most important bit for me is around doing things in the least restrictive way when providing that care and support. And that will link into more around how we're working and about looking at keeping people within their own homes. So we've got some of the more recent census data, and I thought it might be helpful to just run through some of the most recent analysis we've done. We know about the diverse population within Hackney, the number of languages. But what's interesting is that Hackney has a relatively young population, but it's one of the most deprived. It was the 22nd most deprived local authority in England and the 2nd most deprived in London. I also wanted to draw your attention to the most recent census, which showed that 14.3% of Hackney residents said they were disabled. That's over 30,000 people. But if we think back to that last slide I just shared, adult social care is only supporting 3,300 people. So we're actually supporting a very small part of the population that states that they have a disability. So on the last 2 slides that I'm going to speak to, I just want to talk a little bit about the national drivers and why the conversations around adult social care and housing are becoming much more pronounced. There was, when I say recent white paper, a little while ago now, titled People at the Heart of Care. And there was a very pertinent quote within that states that every decision about care is also a decision about housing. So where we live, a place that we call home, and the quality and safety of that home massively impacts on our well-being. And given adult social care and the Care Act is all about well-being, there's clearly a very strong role for adult social care to have leadership and help to drive forward that focus on accommodation, housing, and again, what I said, people having a place to call home. The white paper also sets out its ambition or its intention to support local communities to build the partnerships and plans to embed housing as part of the local care and health system, and both increase the availability of specialised housing and adaptations to people's own home. And this is incredibly positive. However, concern has been raised, for example, by the Local Government Association. In particular, the LGA noted a strong signal to supported housing providers and developers that investing in supported housing is a long-term decision and that it requires sufficient and stable revenue funding. And then the last slide I wanted to speak to, and it's just strung together another recent or kind of more national focus, is the Commission on the Role of Housing in the Future of Care and Support. The report calls on local authorities to build the partnerships and plans to embed housing as part of the local health and care system, to extend choice and to make it easier for everyone to adapt their homes to enable them to live independently and safely. They set out a number of recommendations, but I will highlight just a few of these for scrutiny panel, which was firstly to do as much as is as feasible to enable people to live in their own homes if they choose to. Again, that's really important around choice and control and helping people to remain within the community. The second recommendation was to develop a diverse range of different housing with care and support options for older people, broadening choice at all levels of affordability. And again, in light of the cost of living crisis, that's something we really need to keep focus on. And the third one I wanted to pull out recommendation was about ensuring plans include a long-term strategy for shifting investment into innovative, preventative models of housing with care and support. And on that note, I'm going to hand over to Helen for the next portion.
Thank you, Georgina. Also thank you, Councillor Haynes, for your introduction. What I wanted to make the point about before we talk a little bit more around what housing with care options might look like is also the balance between this being a good thing for us to do financially, but also, as Georgina has set out, the right thing to do for our residents. So I wanted to be really clear up front. This isn't a poor man's alternative to residential care. It isn't that someone who should go into residential care is being diverted into a lesser form of care. It's about building that range of options. So at the moment, we don't have alternatives, or we don't have many alternatives to residential care. So we believe we have some individuals who are going into residential care who, if we had alternative forms of accommodation, we could keep within their communities. Can you move on to the next one, please, Georgina? Thank you. So I think we've talked about this, Councillor Hayes, you mentioned it in your introduction. One of the reasons we really want to explore developing more options of accommodation for people with care needs is around the fact at the moment that the single biggest option we've got, that the highest proportion of people going into residential and nursing care, means that funding for those placements comes in its entirety out of the adult social care revenue budget. And Councillor Hayes, you mentioned about, do we have a view about how many people currently in residential or nursing care might come back into the borough if we had alternatives? I suppose what I want to stress is this is probably for me more about avoiding people going in the future. So one element of how we manage the budget in adult social care is actually around demand and controlling demand going forward. So as we've seen, the number of people eligible for and in need of adult social care is going up significantly. And if we don't have that range of alternative accommodation options for individuals, we have no choice but to utilise more expensive and more restrictive residential care than we might otherwise use. So there may be a proportion of people that we would, as Georgina says, very carefully review and look at their circumstances, who may be able to move into a less restrictive form of care. But the most important thing for me, I think, is that long-term view around, although we have a young population, we also have a number of working age adults with needs and care and support needs, and our population is gradually getting older. And it takes a while to build things. So when you're thinking about capital build programs, we need to really be thinking now what our demand will be 5 or 10 years from now, to have those options available. Next one, please, Georgina. So I thought it might be helpful just to summarise a little bit the types of things we're talking about. So for older people, when we're talking about alternative forms of accommodation with care and support, the main kind of option that we would be looking at is extra care sheltered housing. So people will probably be familiar with sheltered housing, and it's not dissimilar to that. It's a scheme of flats where everyone has their own front door. But what Extra Care does is allow us to have a care provider on site 24 hours a day. It also means that that care provider can tailor the amount of care that individuals in that scheme need, dependent on when their needs fluctuate. So it's actually a very flexible form of care. It means we can provide 24-hour care, but it means that people can also maintain that autonomy and independence about having their own living space and their own front door. This isn't just about older people though, as I mentioned. We're also looking at a number of different groups in Hackney who have different accommodation, care and support needs. So we would also, I think, want to be looking at developing 24-hour supported living. And to be clear, we already commission 24-hour supported living placements from a range of different providers, not many of which are in Hackney. Some are, but not many. And those schemes tend to differ from Extra Care in that they tend to be smaller and usually more suitable for people, for example, with a mental health issue, a learning disability, autism, physical disability, a range of different issues. So where we're looking at schemes for those kind of individuals, they'd probably be more along the lines of a kind of shared house with care and support on site, rather than a large scheme with lots of people having their own front door. But importantly, all of those individuals would still have their own tenancy. And for a small minority of people we support, actually they don't need support 24 hours a day, but they're unable to live independent because of their physical environment, because of their accommodation. So specifically people with physical disabilities or possibly with a sensory impairment, if we can't, through the private rented sector or council accommodation, find a home that can be adapted to their needs, we may want to look at schemes that are 9 to 5 supported living, that will allow people to have that degree of independence, but perhaps live in more of a kind of community feel. Can I have the next slide, please, Georgina? Nope, that's worrying. Okay.
Helen, we've got it all in the pack. What other types of options are available with clients' needs? So if you want to,
fine, I'll keep going. Yeah. So just again for completeness, so people kind of understand the range of things that are available and what we do currently offer. We thought it was worth mentioning again around our HRS grant. So that's our housing related support grant. So there are a number of people in Hackney who don't quite meet the eligibility for adult social care, but clearly have a need for support. And HRS allows us to support those individuals who might not be Care Act eligible, but will need support to maintain their tenancy or to maintain their independence. And broadly that splits into kind of two options. One is floating support. So the vast majority of our HRS funding goes into floating support. So for example, that enables a support worker for a couple of hours a week to go to an individual or meet with an individual in their own home and help them, for example, to keep up with their bill paying or to make sure that they've paid their rent. We do have a smaller group of people who are not Adult Social Care Act eligible, but who we do support in accommodation-based type care, usually supported living facilities, occasionally a hostel environment. The difference from kind of mainstream supported living for those individuals is that in those cases, those facilities and providers work around the principle that that's a kind of interim housing solution in order to support those individuals to live independently, usually in the PRS sector, after about 2 to 3 years of support. So we tend to talk about that as kind of move on accommodation. and we have some of that available as well. So you've got it in front of you, what we've currently got. It's probably worth summarising again. I know we've talked about this in Scrutiny before, but Hackney is known as what's known as a net exporter when it comes to care provision. And what that means is that more of our residents go out of the borough than we are able to accommodate in borough, particularly when we're talking about things like residential care or supported living. So last I checked, I think about 68% of all of our placements for residential and nursing care are made outside of Hackney. We do have a handful of very good care homes in the borough, and just for completeness, they range from very small care homes for adults with learning disabilities up to quite large care homes for our older adult population. We've talked before, and Terry-Ann is on the call, and we're very pleased to have her around our housing with care schemes. So we have 16 schemes across Hackney that can support up to about 318 individuals, where people do indeed have their own tenancies. And those schemes, the care within them is provided directly by Hackney. So we employ those care staff. The schemes themselves are owned and managed and run by a range of 4 different RPs. And as I've said, we do have a number of people who are already in supported living provision. A lot of those, however, not within Hackney. Just to give people a sense of how those kind of placements break down, we've given you the latest number and how those have changed over time. As I said, there will be a proportion of those individuals who, had we alternative accommodation in the borough, may well be eligible and suitable to be moved back into the borough. I wouldn't like to guess at this point what that proportion would be, and it would be very much down to an individual assessment of that person and their circumstances. So our main priority is that where we have a successful placement that is meeting someone's needs, that they are happy within, we would not seek to disrupt that. So we would have to look very clearly at people who perhaps want to move back into the borough, and whether we could accommodate them in any alternative provision that's developed. And there would be a programme of work to do that.
Thanks. I mean, I think I was you probably using that as a proxy, probably quite a crude way, just to try and understand what from the financial people's mindset, what the potential would be. So maybe another way of looking at it would be for every new placement that you make in the next year, or you have made over the last 12 months, how many of those, and this is maybe something, Will, if you're not doing it already, would invite you to possibly do, if there was one of the other options you've talked about available in borough, how many would could possibly be dealt with? I appreciate your point that this isn't some sort of lesser service. How many of those could possibly be dealt with by an alternative, possibly better for them, more tailored provision in borough? Because I suppose from the financial bods and from the housing people, they need some firmness as to what's being talked about here. Otherwise, it's too much risk, I suppose, from a financial point of view, they would say.
Absolutely. So what we're coming on to talk about now, Councillor Hayhurst, I suppose, is next steps. So hopefully we've kind of given people the context and background of why we think this is a good thing to explore. And the question for me then is, how do we do that? And I suppose I want to make 2 points. One is this will be about us working differently as a council, because this would have to be a business case and a programme that is one long-term, because it's not a one-off build, like, for example, Britannia Leisure Centre. We would be looking at what demand do we have going forward over a number of years, when do we think that demand is going to come to us, and how do we match the supply that we have in terms of available land or available assets, and the funding that we have with building the appropriate accommodation to meet that need going forward. I think the other thing is that this is potentially a different way of working for us as well in terms of how we think of the financing. And we've talked previously, I think, very briefly in this committee around this is not the same as building, for example, council housing and the kind of manifesto commitments that we have towards building those 1,000 council homes. Partly that's because we are looking at probably a range of different accommodation options, not a single model. And we're probably then looking at a range of different financing options, not a single model. So for me, the next steps really are bringing together people from across the council, from planning, from regen, from housing, from finance, and developing, as you say, that business case that says, well, what is the financial model that we would seek to use for this, and what are the long-term benefits? I suppose the final thing that I would say is there is also something about co-producing that with the residents who are likely to need it in the future, because whilst we have and are very proud of our housing with care schemes now, they're not necessarily in the places of the borough that our older people would want them to be. So actually location and how we access parks or shopping facilities or green spaces is equally important when we're planning this provision, and to ensure that people can remain as independent as they want to be. So I'll pause there and hand over to my housing colleagues, and then obviously very happy to answer questions at the end.
Thank you. Just to finish off, I mean, on my rough calculations on those, just on from the financial angle, on those hotelling costs, 300 a week is around 16,000 a year per individual. It may be unachievable, but if say going forward, half the individuals could be dealt with in place, that's nearly 4 million.
Yeah, that we're not talking small amounts of money. It would be.
Yeah. So I'm just trying to get some sort of gauge on what the potential may be, albeit I appreciate your point. You need to do more work on it.
Yeah.
To understand it. So over to Stephen and James.
Yeah, great. Right, thank you, Chair, and thank you for inviting us tonight. This is a real timely opportunity to be talking about this stuff. I'm not Rachel, you would have seen that. Rachel is one of my fantastic heads of service who covers this area of our division. And I think it's just, for those who don't know me, I'm Stephen Haynes. I'm the Strategic Director of Economy, Regeneration and New Homes. And I think it's important, Chair, in the context of this discussion, that we're not just the housing people. And actually my remit covers, housing regeneration and delivery, but also employment, skills and adult learning. James's area, which is housing strategy and private sector housing, the town centre area regeneration and economic development function. And the reason that I make a point of saying that, and actually, sorry, Councillor Kennedy, as of this week, also culture, libraries and heritage. So, and the reason I say that, Chair, is because we're also as interested in the needs of residents across the piece and the opportunities that we can sort of derive from working across sort of boundaries. So what I'm going to do now is really sort of take you through some relatively basic stuff on the housing regen stuff. And I'm really sorry that members will know a lot of this, but I think in terms of discussion, it's about really sort of setting that that context. So I'll take you through our new homes building programme, the objectives, and how they relate to those manifesto commitments we talked about. I'm also going to talk about the new sites that we've identified for the future programme, and also our approach to adaptable homes. I'll also set out how we deliver this stuff, and I think that's really important, again, in the context of this discussion, and the way this part of my division is structured, and also the way that we've historically funded the programme and the current challenges that exist within that as well. It's important to say that my area is one part of the council doing delivery. In this case, it's new social homes. As Helen rightly said, we have Britannia, we have other schemes, we have the school estate stuff, and also the stuff that Pritchard will talk about. But I think herein lies the opportunity. There's a huge amount of skill sets within the organisation about delivery and how we do stuff. And I'm really keen with Helen, Georgina, everyone else to explore that. And finally, in this sort of very long preamble, we're really, in my areas, we're really acutely aware of the challenges that adult social care face, both financially, but also, as Helen rightly said, in terms of what our residents need. So we are really, really up for doing what we can, both in my services, but also corporately, to move things on. Thank you. Oh, you've done it already, Jar, thank you. So in terms of our building programme, I think, look, we're rightly, is that the right slide? No, I think you've done a bit far ahead. Yeah, so we're, I think, as a council and as administration, you should be rightly proud of the approach that's been taken in this space. As you can see from the slides, we've delivered nearly 3,500 homes over 30 sites since the programme was conceived. These are big and small sites, so large estate regeneration projects, but also smaller brownfield sites and land. And importantly, it's worth saying that this has been a self-funded programme. That is to say that we have built outright sale units to cross-subsidise the delivery of social rent, shared ownership and other affordable products, always ensuring that we're above the 50% threshold. But it's really important to stress how challenging the fiscal environment is now for us as it is for others. Cost inflation across all aspects of our programmes has gone through the roof. So over the last 2 years, we've experienced about a 30% increase due to the impacts of Brexit, associated supply chain issues, the pandemic, the war in Ukraine has significantly exacerbated those pressures. So there's been a huge increase in cost, which has made us think about how we deliver stuff and the way that we do that. And that's obviously impacting on how we move forward. I talked about in-house delivery. What that means is that we've pioneered an approach that others now follow. So we've basically got a team of project managers who deliver schemes. We work with our in-house design team and other support functions, and we literally contract people to do the building. We do everything in-house. But as I say, we need to think differently. Again, as Helen said, work differently, not least in how we respond to these very challenging macroeconomic conditions. So we're looking to make sure that we put the right skill set moving forward. The bottom line is that we've funded the programme, so there's no cost to the HRA. Again, that is to say we recapitalise against the HRA, so in theory it's a cost neutral programme. Thank you, Jonathan. Next. I won't go into this in much detail because it's pretty self-explanatory. We take a holistic approach to development, so we're always interested in those wider public realm, non-residential use issues, but again, critically for me, with my wider remit, socio-economic and social value outcomes. And we're doing a lot more in that space now. And we're really interested in how we use land in the best way. I'll come on to that in a sec. But there are lots of pockets of land within the borough that can be utilised and activated, both in terms of housing and, as I'll come on to, potentially other uses as well. Thanks, Jonathan. Again, as I said in the preamble, we're doing the how and the when of this, but the sort of what and the why has been determined by the administration, and that's why what we're doing is fundamentally linked to the manifesto commitments, both historic and current. During the last administration, 2,000 homes were delivered. We've now agreed, well, it was agreed in May at the election, of course, but we've now agreed the delivery arrangements for 1,000 social rent target, which we're all really excited about. Hugely challenging, but a very bold and ambitious plan. But again, it's being delivered against the backdrop of the pressures that I've talked about. We're taking a no stone left unturned approach to how we do this, in terms of thinking differently, working differently, looking at, as Helen said in the context of social care, we're doing it in my area, thinking about financial models, how we leverage whatever we can. And then I'll just go on to the new sites, which is a critical part of this. So existing phases of the current scheme are going to deliver a proportion of the 1,000 social rent target, but the future new sites programme is a key tranche of this commitment. So we've basically, historically, as I said at the beginning, cross-subsidised our approach to delivering social rent and shared ownership through outright sale units. For the new site programme, which the Mayor and Cabinet agreed, as Councillor Kennedy will recall back in December, we are flipping that. So we are delivering 75% of that 400 homes as social rent. We're doing that through the utilisation of a one-off capital receipt that we've identified from a historic overage, the details of which are in the Cabinet report. And we're really excited about this because we've actually got the ability to shift the dial a bit on this. But we've also done this by identifying sites to deliver these homes on. We've undertaken a really in-depth analysis and review of the HRA asset base within the council, what we own, and how we can use that better. And that's formed the basis of how we've identified the sites for this programme. Many members will know in terms of engagement how that's going. Cllr Patrick will be aware of that. So we've gone out, we've taken a fine-tooth comb to what we own and what we hold within the borough, within the HRA portfolio. But what's potentially really exciting, Chair, about this is that a lot of those sites aren't suitable for general housing. So what are they suitable for? And Helen rightly say that these small sites that we're not going to use for general housing need LD mental health facilities. I mean, there's a really interesting and exciting, proposition here. So we're very keen to explore that. And indeed, Pritchard may talk about it, but the general fund asset base, which is significantly smaller than the HRA, but Chris and others are looking at, again, what do we hold, what do we own, where can we leverage the best use of those sites. Adaptable homes, again, I won't go into this in detail, it's hugely important, but we make sure that 10% of new homes are wheelchair adaptable and they comply with the requirements of M4 as part of the building regs. I'll come back in, but James, can you talk through the housing strategy element of it now? Sorry, Chair, there are lots of nice pictures of our estates. If we can come back to that.
Yeah, we can come back to the commitments and all that as well. Councillor, I'm sort of racing to the end about the housing strategy and we'll come back in. And while Jar left that, so to put it into context, we have, at the moment, the housing strategy is dated 2017 to 2022. It's 2023. We currently have a housing position statement that sees us through the rest of this year because we're developing a new housing strategy as we speak. One of the key questions you mentioned at the beginning, I don't want to paraphrase you, Chair, but it's why haven't we thought about this before? To an extent, we have. The current housing strategy, I'm not going to pull punches here. It mentions supported housing and our plans for it. What that strategy has done, though, is focused hugely upon private sector housing and building safety over the last 5 years. So written post-Grenfell, and you can see the way that that strategy has developed and where the priority has been. Within the context of that strategy, though, and within the context of supported housing, for want of a better phrase, not just older people, but some of the things you've heard Helen mention and Stephen mention, it's starting to look at financial models, funding models, what the supply is. Some of these models may be completely different to how Hackney's operated before. Maybe, might not be. We're not leaving anything off the table here. Joint ventures, pension fund schemes, things like that can come in. And again, that's certainly within the purview of the scrutiny and what we'd welcome, working with you to investigate and look at those things. That will help us develop those parts of the new housing strategy, which will, I've been on the record of saying this many times, have a huge focus on supported housing. We currently, just another strategic point, we currently have the Ageing Well strategy, which I'm sure you're fully familiar with. In there is a chapter that kind of, for want of a better phrase, it's older people's housing. The decision was taken, rather than develop a separate housing strategy for older people, stick it on the shelf, and we would look at it within the context of the broader older people's thing. Officers have worked clearly across the council very well to produce that housing statement, that housing chapter. We are using that at the moment as our action plan, our guides, everything that's in there, everything you want to talk about, everything you may want to look at in the future, how we work in partnership, how we supported private renters, what we've lobbied in, we can develop that and look at that in more detail, but we've taken that all on. So that's where we are. What we're doing at the moment is really important. We're currently doing a housing needs survey and a strategic housing market assessment. They are the long-range planning evidence tools that allow us to determine what housing we need in Hackney over the next 5, 10, 15, 20 years. Housing needs survey is critical because it picks up all of those things and groups that you've heard Helen and Stephen mention. Strategic housing market assessment is more of a technical look at affordability and everything. They come together, and this is the critical evidence base that underlies what we do. stock condition surveys are what they are. We are looking at stock condition constantly in both the private sector, the housing association stock, and our own stock. What can we do with it? What do we need to do with it? How do we need to refresh it, retrofit it, etc., etc. Final 2 points on that key action slide. We have an action on us in the strategy that will review supported housing needs, and we will be developing an older person's housing strategy. I suggest that that's going to be further and wider than just older people. It will do everything it can. It's so much a complex picture now. So learning disability, mental health, complex conditions. People are living older and longer with multiple diagnoses. It's a complex picture. How does housing come into that? Where do we need the wheelchair housing? Where do we need the lifetime homes? Have we got our model right? What are we doing? How are we working with our partners? I'm sure you all know Anchor-Hanover. We transferred all of our shelter stocks to them 20 years ago. We can debate the rights or wrongs. We won't do that. We'll be here for another 3 hours. But that how we work with those partners as well, council, is really critical. They've got 20 odd schemes. Some of those sites have got fantastic development opportunities. Some haven't. They're in the wrong parts of the borough, some of them. So there's an opportunity there, as well as thinking about how we do stuff. Our aim is, like with the regeneration programme, to deliver it in-house by ourselves as much as possible, but working with partners too.
When do those strategies or those surveys surveys come to sort of an end?
So
when you sort of have some results from those?
So we get in simple answer to that question, both the housing needs survey and strategic housing market assessment will be reporting this summer, July, August. Okay. We will then have a draft housing strategy to cabinet later this year, which will be the first draft. That will get, or not, but we hope that we'll get approval from councils for us to take the final 12 weeks of consultation, so you have a fully constituted housing strategy towards spring next year. But in practice, we'll have a housing strategy November, December this year.
And so is that specifically sort of, I appreciate your point that it's taking into account sort of a broad range of areas and it's highly complex, but is that sort of specifically having in mind the sort of the very specific point Helen's team's sort of got in mind about, so if we were just to say an extra 200 across the different, for example, units across the different types that Helen describes, if that's what the need was, that it would sort of look about where they could be placed and the technicality of the costing.
One word answer, yes, councillor. That's 2 words actually, sorry. Yes, with the conference that it is, housing strategies though are multi-tenure. So we will have to look at all of the issues across housing in Hackney. That's private ownership as well as private rented as well. But there will be a significant, for want of a phrase, a chapter that covers supported housing. And if you say that, use the 200 unit example, if that's where we've got to, that's what the housing strategy will say.
Fine. And then you've got everything you think from Helen's team to inform that. So, I mean, obviously, what I was asking Helen in terms of, well, you've got to roughly know that you've got to, from your point of view, you've got to roughly know what sort of numbers could be diverted out of going forward.
Yeah, we do, councillor. So it's simple for me. I can sit back and say to my social service colleagues, tell us what you want. Yeah. But we work together. There's a mix in this housing needs survey approach. So we get the kind of desktop service, a very accurate desktop service data we get from Helen's colleagues as well as children's colleagues. We also hire specialist consultants, statisticians, all that stuff to model what we need for the long range stuff as well. It's a combination of all those things. As Helen pointed out very articulately, building takes time. And those buildings are there for 100 years. We've got to get it right. So that future modelling is where we hire our consultants to tell us what that stuff looks like at the moment.
The question of that, are you factoring into that Helen's point on the hotelling costs?
Yes, we have.
Okay. Can I just then bring in Chris, if that's okay? If you've both finished. Chris from the Ian's department in terms of finance. Chris, do you want to give us your observations on this, and then I'll throw it open to questions.
Yeah, I'd love to. Thanks, Chair. Yes, I do report to Ian in finance. I'm his Director of Strategic Property Services, and my remit covers general fund property, so most of the stuff we own that isn't housing. That includes schools, town halls, offices, libraries, etc., etc. So, and my team, one of my teams is corporate asset management. So we are responsible for setting the strategy for the corporate estate that we want to hold going forward. why we want to hold it. We've got to keep it maintained and so forth. And we have a good view through that team right across the asset portfolios that the council holds, and they are quite varied. Varied in size, varied in types of use, and so forth. So what's been happening so far is my head of asset management has been working with Helen's teams to establish actually what it is that Will has talked about, the work going on in understanding demand and the different types of facility that are required by our different types of clients. So my team will work with Helen's team as that picture builds to understand what sort of facilities Hackney should be offering to meet that demand. When we've established that, we can start looking at the best way of delivering it and what suitable models might exist and how we might fund those consistently over time. Another point that's been mentioned, I think, by Georgina first as being crucial. And we'll help build the business case for a suitable model for suitable products. We do have experience of this in the past. Borough being at the centre of it too. For example, we're putting 2 new GP surgeries on sites that we owned and really didn't have a really good hack use for. In that case, the funding is relatively simple and straightforward. It's the NHS agreeing to sign a lease at a certain rent, which will pay back the debt used to construct those facilities. So we're used to, and finance colleagues are well used to working in this way. We've got experience of building those business cases. So I must say I'm looking forward to seeing how this develops with Helen's team. It is a fascinating area, as I think you said, Chair. I also know that at the moment, actually, just by way of context, the audit committee has scheduled, I think, a deep dive into council borrowing so that they can understand it better. So I think we should be developing this thinking with all elements of the council, being well informed on borrowing and how local authorities go about doing that. So I think we're in a good place. As I say, we've got the experience where once we know what products we need, we'll have a better idea of where to go looking for the sites or the facilities. They might exist already. They might appear in our estate already somewhere. They may exist within partners' estates, and there may be partnerships we can bring forward and do joint developments and things like that. I really don't know. I'm just trying to give a sense of the possibilities once we've developed a robust business case.
Thanks, Chris. So, I mean, as I understand that, before I open up for questions, as I understand the current state of play is that we're waiting on the technical surveys that James has talked about, a business case that Chris has talked about, to then possibly then assess it and take it forward. I mean, I understand part of this, you might need political impetus and for that to be prioritised, but I suppose that to the extent it's chicken and egg, because depending on the business case, it might make that far easier if the business case stacks up quite easily, depending on the figures. So I understand that. I see Helen wants to come back in. Just before Helen does, Stephen or James, one thing I didn't ask was, I know it's probably a moving feast and might depend on where on the borough, but to build, say, just a new 1-bed at the moment, not the sale price, but the core building cost, what sort of figure? What sort of figure are you working with at the moment?
Yeah, I think it is a moving feast, yeah, but I think it's probably just over 300 grand for a 1-bed, and that's simply build cost.
Fine. So I roughly did the very crude calculation before the meeting of the 15,000 on the base of a £400,000 build cost, and I got to a 20-year payback point. But of course, that could bring it. I think that was incredibly crude, and I appreciate there's all sorts of calculations to be factored in, but just to try and understand what the sort of medium term was. Helen, and then I'll open up for questions.
Thank you, Chair. I suppose just to say we're not waiting. We've got a working group together across all of those elements, including finance, because I think whichever way we do it, in a sense, there isn't a choice, because if we want to manage and control the adult social care budget going forward, we have to have alternative options for accommodation with care. It will financially make sense depending on how we configure things, and also it's the right thing to do. So what we're doing now is working together to come up with that big business case. As you say, it's a little bit chicken and egg, but doing that in-depth financial modelling and demand modelling, looking at the assets we've got, bringing that all together really to come up with a forward plan around how we can deliver whatever it is we're going to deliver going forward.
Thank you, Helen. Can I open up questions? Cllr Patrick.
Thank you. This is a subject I know quite a lot about, having been around when we built the first extra care in the 90s, when we closed down our old people's homes because they weren't fit for purpose, and built the first extra care. And I was also on a housing association, a provider of supported living for people with learning disabilities. So it's a subject I know a bit about. So I just wonder, I mean, I can understand that we need to do some research into who exactly who's going to need services, but I'm not sure how much research we actually need to do into the models exactly. You know, I mean, it's not something new. It's been done all over the country. It's been done for the last 30 years. And I really like to see some bricks on the ground. I'd especially like to see some of the housing that's being developed at the moment. I have suggested a site for you in my own ward. I'm always happy to have council housing built in my own ward. I know there's 2 sites being developed, and I'm happy for sites in my own ward to be used for extra care. But I really think we should get on with it. I mean, presumably also, if we build extra care housing, some of the people going into that extra care housing will also release general fund housing. So there'll be a win-win. And also, I mean, we talk about the money, which is important, obviously, because adult social care budget is overstretched, and we're not getting any more money from government, we're being cut. But it's also the right thing to do, you know, to keep people in the neighbourhoods where they're being supported by their friends, their relatives, for both older people and people with health problems, both learning disabilities and mental health and physical health problems. I mean, you know, being crude, I mean, we're all living longer. Hopefully, we're all living longer. People with disabilities are living longer, and also people with disabilities expect to live lives in the community that they were brought up in. They don't expect, you know, we shouldn't think that people with disabilities should be shunted out of the borough just because we don't have appropriate housing for them. You know, we should be looking at appropriate council housing and perhaps housing association housing. There is schemes, certainly for people with learning disabilities in the borough, and we should be looking to build those schemes within our general fund budgets, general housing needs budgets, because they are our residents and they need social care just like families do. So I'd really like you to come back to us soon, saying that you've identified sites and we're going to start building. Obviously, I understand you need to look at financing perhaps for the longer term, but we do have money, as you've said, for this round of building. So I'd like us to try and build something because it's not appropriate for people to go into residential care.
Too much comments in relation to that. I mean, I suppose, yeah.
Yeah, I mean, I'm in complete agreement with Councillor Patrick. I mean, I think the issue here is that we're all in agreement that this is something that we need to do. In terms of, I mean, I'll leave it to Helen to talk about finance and modelling and stuff, but as she said, and as you said, Councillor Patrick, this has been done elsewhere. This is a case of bringing stuff together and considering the best option for us, I would imagine. In terms of the sort of site piece, as I said in the presentation, in terms of the HRA asset review that we undertook, we've identified 15 sites, Councillor Patrick, for general housing need, but there are scores of other sites that have been identified as part of that process that we can now throw into this mix and consider the best use of. Again, as I mentioned, Chris is doing a similar exercise with the general fund, and while it's much more limited, we are thinking about how we use assets in the best possible way. And in the context of this discussion, it's very much about well, this area. James, anything to add?
Yeah, I mean, again, I don't disagree with you at all, Councillor. We are talking to Sanctuary about something in your scale. There are discussions going on. I didn't want to mention the word, but Helen will talk about. Helen's got the. So the thing with models, we're not saying we're taking another year to sit back and and ah and blah. But for example, extra care shared ownership. I actually, if you put me on the spot now, I don't know. I can't tell you if that would or wouldn't work and what this mum would be in Hackney alone at this stage. Yeah, and I'm not. That's just a classic example of something. Yeah, yeah. So again, in other boroughs that I've been in, and we did difficult getting mortgages, went through all that kind of thing. But say take extra care for older people's villages, things like that. Is there something we could do, perhaps in partnership with Tower Hamlets? I'm not, there may be other ways just here. So I'm not saying that we're going to spend another year doing models and what have you. There are live conversations, as Helen said, teams are meeting at the moment. I've already had meetings with pension funds about funding stuff. I've had meetings with joint ventures, as well as do it. We'd rather do it ourselves. But there's other ways and means perhaps we've got to look at as well. What we're not doing is brushing it under the carpet and saying it will take us another 2 years to do that stuff.
Councillor Samatar.
Thank you. I wanted to I don't know if this is more for Georgina or Helen, or both of you. Let's go crazy. So I wanted to ask, in the stats of that you mentioned earlier, forgive me, I'm going to take you back to the beginning of the presentation, about 25% increase in adult social care since 2020. I was wondering if you could shed some light on why you think what could have led to that increase. We know, but just wanted to have your thoughts. Thank you so much.
So I'll start, Georgina, and if you want to add anything. I think it's a really good question, Councillor Samatar, and I think it's a complex one, unfortunately, to answer. I think probably what we're seeing now is what we suspected would happen, which is the pent-up demand from COVID. At least in part. So we know that people managed through the pandemic and they were possibly managing their lives, but lockdowns and COVID have had quite a dramatic impact on a number of people. We also know for older people that actually the not being able to get out and about and move around as much decreases their functional ability. So I think in part it's to do with that pent-up demand from COVID. I think in part it's probably to do with the cost of living crisis as well. It's a very difficult time at the moment from all sorts of reasons. And we heard earlier from our colleagues in the Mental Health Wellbeing Network around the impact that they're seeing. So I think possibly there's a number of factors, but those would be the two that I would say stand out to me.
Thank you. I saw Councillor Kennedy next.
Thank you. I just wanted to talk about the broader sort of government context of what we've been talking about, because with the move to integrated care systems, it is very clear, and all the mood music from both the main political parties, so from the current government and the probable next government, and the NHS, it's about how important it is to provide as much care at home and as close to home for people as possible. The NHS doesn't want to be taking people in quickly. In an ideal world, it doesn't want to be taking people in at all. It wants care and health care to be able to be delivered close to where people are. And the kind of accommodation, adapted accommodation that allows people to stay at home absolutely meets the need of the whole system, irrespective of the political colour that you are. And I think net exporters of people, like we are, as we saw in the figures earlier, you know, roughly 2/3 of people who go into a care home leave us, and areas like Havering, where they have lots of care homes and they import people, have both found disadvantages of that. In your ideal balanced world, you do not want to be either a net importer or exporter, and the system is going to try and help you as a local authority to reach that balance.
Out of interest, just on the figures that were provided in the slide pack, in the long-term nursing, which obviously falls under an NHS budgetary scope, is there, Helen, do you think, because obviously that's also a higher need bracket, I would have thought, normally. I mean, is there much scope there in that bracket, do you think, for much alternative, better placements in the interests of those people? Or are we more talking about the long-term residential under the council bracket?
So probably not in nursing terms. So if people need nursing provision, that's what they need. There is a longer term discussion about whether we want to develop our own nursing home facilities within Hackney. And I think, just to be clear on that, Councillor Hayes, the individuals in nursing care may well be receiving a contribution from health, but actually the ones that we're talking about on that slide are funded by us. So although we say nursing care, that doesn't make them automatically health funded. A lot of them will be in receipt of what's known as FNC, which is funded nursing care, which is a small contribution towards the cost of their placement, but social care will still be responsible for that placement cost.
Thank you, I didn't know that.
Yeah.
So in other words, for those that are in nursing care, the NHS contributes what they may describe as a nursing element, but the other element, the housing, and is met by the council. I didn't appreciate that before.
Generally, that's very kind of generalistic as an approach. Some of them obviously will be in receipt of continuing healthcare. There'll be a variety of funding forms, but if they're in our figures, we're funding them.
Thank you. And just before I bring in Cllr Turbet-Delof, Cllr Kennedy, in terms of you championing this on a political level, because obviously there are many competing priorities, as we all appreciate, are you of the view that you need the business case to sort of understand what you're championing first, or what's your view to championing this to cabinet colleagues?
The reassurance actually that we've heard in the room tonight, that the work is going on across our departments, because in a way what we've seen as perhaps our biggest problem in the past, if you go back 5 or 10 years, is that as a council we work too much in a siloed way, and absolutely the instruction that we've had at the moment from the beginning of this administration, actually through the previous administration, was it doesn't work anymore to make our finances stack up to carry on doing that, which is why what you're hearing tonight is the way forward.
Thank you. And Cllr Turbet-Delof.
Yes, thank you. I have two very brief questions. One is, earlier we heard that in the 2021 census shows that 14.3% of Hackney residents said that they're disabled, so 30,000 people. How does this data correlate with the 10% of wheelchair adaptable homes as well built? And the other one, very quickly, is just, and I'm not sure if it's a mix for both and all of you attending today, and it's about meeting and community spaces within the homes for adult social care. Yesterday I was attending a session on mental health, isolation and safeguarding, and a point that came back, and sadly with very sad cases, was about those lack of spaces or community spaces for older people, and how many older people in the UK have fallen victims of scamming, and they were calling, Age UK has called on adult social care services to sort of join forces to combat this, so then the elderly are not falling into this scam. So I just wanted to hear, perhaps within this strategy, where does that fall as well? Thank you.
I'll do the first question, if that's okay. So I'll defer to colleagues for the second question, Councillor, if that's okay. So on the first question, 10%, 14%, the straightforward answer, Councillor, is that there isn't a straightforward relationship between 10% and 14%. Yeah, the 10% requirement for wheelchair home is a planning guidance policy. Simple. So the 10% wheelchair is a planning policy guidance point, as opposed to anything based upon what your assessed need may or may not be, is a 10% requirement. For example, on that 14% census stage, it says disability. That can be everything. The 10% wheelchair standard is a physical disability wheelchair standard rather than any of the other things you might do. It's something that we can look at. The wheelchair standard is, in practice, I mean, you probably know this, but wider circulation space, wider doors, entries, ground floor, and things like that. It pertains very much to physical disability. The units are bigger, they cost more. So there's all those factors we take into consideration. There are many other forms of disability, though. So that 10% is quite a tough target for us to meet, particularly when you're looking at the ground floor. So and we haven't always met that, but it's in there, and it's a key part of the housing strategy. If I can push it, I will. We're not far. We have met that target on schemes, and we've gone over it on some others. So across the whole portfolio, we try and deliver. There have been some weird cases where we've had wheelchair units on higher floors. We've had to do that for various reasons. Sometimes the wet rooms don't work, they leak and all those sorts of factors are in there. So we've got a good lot of experience, a good lot of understanding on this. Again, we won't move. I think it's important that we have a minimum of 10%. If we can get more than that, we will do. We've got to look at our understanding of the other forms of disability, which is where Helen's stuff comes in, and the housing needs survey will come in as well.
And Helen, on community spaces, do you want to come in there?
Yes, please. So absolutely. In an ideal world, and what we'll be looking at doing when we're planning what these schemes look like, is to make them part of the community. What I don't want to build is institutions. So that's part of the question, and why we want to work together across council to look at who would use the schemes, where are they, and what are the communal spaces. So if we, and I hesitate to say this because it can be quite contentious, but if we look at, for example, a site like St Leonard's, there's a huge scope there for that to be multi-generational use with a mix of health facilities, care facilities, and community facilities, almost kind of creating that campus support and care village type feel. But any scheme that we build would have to look at, particularly extra care, what are the communal spaces and how can we use them?
Stephen?
Can I just add to that, Chair, and say that I think it's really important in the spirit of sort of working across different services and teams that we think about community assets and community halls and this sort of stuff in the context of housing generalist, specialised, universal, whatever, because there's lots of stuff out there that we can think about differently. So I just make that sort of internal plea, really.
If I can just follow on from Stephen's point as well, Councillor, now we've got it. The conversation tonight has been, exactly what it needs to be. I just put from the perspective of an older person's housing strategy, there's some real key things in there as well. We haven't really touched on under occupation, how we've been working with people across the into, to support people to move from that into a more appropriate form of accommodation. All of that adds up as well. It's easy for us to focus on financial models and new build development and everything, but our strategy has been really focused. We've had Cambridge University assessing and advising us on how, for example, we can get downsizing moves to work much more effectively in Hackney. And that's a key part of the system and what we do to assist colleagues and how we work across the piece as well. I've worked very closely on that with social services colleagues. That's just an example. I know we haven't mentioned it, but again, it's a useful point for scrutiny to look at.
Councillor Patrick?
So I just wondered whether we'd had any discussions with Hanover, who are our largest provider of older people's housing, to see whether any of their housing could be turned into extra care. I mean, that would be quite a quick win. I just wonder whether that had been discussed at all, or any of the other housing associations who provide older people. I know there's a scheme in my own ward which was turned from a general needs sheltered housing scheme into a specialist housing scheme for particularly vulnerable older people. So I know it can be done.
Thank you, Councillor Patrick. The answer is yes, we are discussing with Anchor-Hanover. Is it as fast and an easier discussion as like it? No, it isn't. But we are discussing with them, as Helen will know, so I'm working with Helen's colleagues as well to talk to Anchor, not just Anchor-Hanover, but Peabody too, but Anchor-Hanover in the first instance. They have they've developed a new strategy and a new approach from the new chief executive for their stock across the UK. What we are talking to Anchor about is what we need in Hackney. Some has resulted in quicker movement. For example, development on Woodbury Down, or the stuff we're looking at on Mare Street. Some of the other stuff we will be pushing them, as well as Peabody, as well as Southern, over the next year or so. We've got the compact in place that helps us. Are we where we would want to be? Nope. Will we get there? I'm relatively positive that we can do. I've had reasonable conversations with Anchor about some of their sites where they have development footprint. And we've spoken about extra care, and we're speaking about things like that and about how we can do things differently.
Councillor Samatar.
Thank you. I just wanted to ask another question about safeguarding, in particular with hoarding and self-neglect. I get a lot of casework, and then we obviously, the amazing team in the service, when we provide that, like, action gets done, but we're getting the same issues repeated, neighbors sending like more and more of the same kind of, sometimes of the same street, of the situation happen again. So I wanted to know about long-term adult social care in terms of kind of giving not just the immediate solution to if there's a lot of hoarding kind of issues inside the house or outside, and then I don't know what happens after that, because if that's the same situation a weeks later, how do we prevent that from happening again in terms of giving long-term care, but also empowering the individual in safeguarding with self-neglect and hoarding? Thank you so much.
Sorry, can I suggest, because that's maybe slightly off what we did, can we maybe put that down as for a future item on the agenda to talk about, because then we can explore it in more detail rather than sort of probably just get a quicker answer.
Brilliant.
Now.
Thank you so much.
Going forward. So let's put that down for a future item. Councillor Adebayo.
Thank you, Chair. Just wondering, this is very important in Hackney, and it is well needed. And at the same time, I would like to see a benchmark data that celebrate the success of this scheme in other boroughs, because we are now embarking on a new scheme. So just want to know if you can get that data for the future.
Helen, has anyone sort of looked at it through the hotelling cost before and sort of presented a success story about it?
Yeah, so Councillor Patrick's quite right, this is not new. So a lot of boroughs are probably further ahead than we are in terms of having that strategy and having those capital developments either in train or completed. It's not published as part of the national data set, but we can certainly talk to some of the boroughs that I know have done it and get comparable information to bring back to scrutiny.
Out of interest, presumably that may be beneficial in terms of the business case and or the surveys to present that as well.
Yeah, so as part of that working group, Naeem, Ahmed and I are going to visit the Section 151 officer in 2 boroughs that have set off on this path to understand how they've done it and look at their financial models as a benchmark as well.
Thanks. And I just wanted to ask, I mean, I don't suppose you're going to sort of say anything other than this, but right now, where you're at with what we've said about the meetings that are going on with Chris's department in terms of the business case, in terms of the survey aspects, I appreciate your point that other boroughs might be further ahead, but being sort of realistic about the space we're in, are you happy that everything is now happening that you want to be to try and progress this and explore the feasibility of it going forward, or is there still other things that you would like to see happen?
So I think I'm content on the officer side, and obviously with the support from Chris as lead member. I think it's been a really useful conversation with Scrutiny, and I think for me there's something about socialising this with wider members and the cabinet, so that they come with us on that journey, because it is a journey. This isn't a short-term project. This is going to be a way of working for us going forward. So making sure that everyone is understanding that, and that we can answer any questions or concerns that people have, I think will be quite an important part of that journey.
I mean, that's helpful to know. I think from my, I mean, just thinking from my perspective in terms of, certainly I've had conversations with a few cabinet members. I mean, I think what would assist me in sort of advocating it with full gusto is probably just an understanding of the being able to make the financial case. Obviously, I'm wholly with you on the merits of it for the individuals. But when you're in a place of competing high need across many different areas and a climate crisis, social housing crisis, all those things, to make it sort of stand out is if it saves money in the medium or long term, as well as being the right thing to do, it then becomes a much, be crude about it, a much easier sell to colleagues. I mean, I did, as I said, I did try and briefly put some figures together just to try and understand. So I suppose, I think from my perspective, to sort of, just speaking personally, championing it fully, I suppose, just to have the just understanding what the figures would look like, and then that enables. I don't know, Councillor Kennedy, do you, what are your thoughts?
It always helps to have that. What was the film? What was the phrase from the film? Show me the money. It always helps to have those figures to back it up with. But I'm pretty confident we can find them. I mean, you were started doing it yourself, Chair. You know, when you did your little multiplications of the £300. You know.
So I think just as sort of going forward, I mean, as soon as what comes out of this with the surveys and a business case is if a brief paper, I presume Councillor Kennedy would get it, but if something could come to scrutiny about what different options or models might look like, then that gives us something firm to champion it with in a more robust way. Because I mean, from the officer's perspective, they're working to a manifesto. You know, Stephen's team under immense pressure with stretch targets as it is, and obviously he needs political, I presume, impetus amongst the number of pressures he's got on him as well. So it's really, if there's the finance there to back it up for us to sell more internally, I think that for me, that's the missing thing to be able to fully do it. Councillor Kennedy?
Yeah, I'm just thinking, I'm wondering where it would best sit. Capital program, medium to long-term capital program.
Yeah, I'm sorry, Helen, are you going to come in? Yeah, I'd imagine the medium-term financial plan, but it's a conversation, isn't it, for Helen, Ian, me, whoever. I just did want to make the point, though, in terms of, I think one thing we haven't mentioned, in terms of the working group that Helen's establishing or established, we need to be clear about how we do it and who does it. At the moment, there are, as we've said a number of times, various functions doing similar things. There's a good skill set in place in certain areas, and we need better skills elsewhere. But there's something about agreeing about how we do that sort of delivery bit at the right time as well. But rest assured, we'll be thinking about that as well.
Okay. Unless there are any other questions from members, I mean, I've certainly found that very helpful in understanding where we're at and the potential and what the future is. So I think really, I mean, if I mean, is it too soon to suggest that this be maybe not pulling in everybody, but to get some sort of brief memo or understanding within 6 months, if that's not too soon, about where this is up to, what finance is looking like. I mean, it's obviously not ready, or it's going to be a few more months, then obviously, you know, or whatever. But I think to keep some sort of check on this, because, and also practically speaking, just the way these things work out, we're a year into this administration anyway. Not too long before we're halfway, and then manifestos start to be thought about for the next, you know, administration. So in order to get it on the radar, it's good to keep, I think, a regular check on it. So as a brief report, should we just say sort of 6 months to get some sort of understanding where we are with a sort of the idea of some sort of memo on what the business case and need case could be with different options, which might, I think, dovetails with the sort of surveys coming back, might be just after that. And then we sort of look at it again and take it from there. So unless, with that as a sort of a rough action point, can I thank everybody for that? It's been very helpful, and for us as sort of politicians to understand the various issues, and so we can champion them. So with that, I'll close that item. Meetings of the previous meeting, can I have those agreed, please, members?
Agreed.
Agreed.
Thank you. Work programme, next meeting's 13th of June. Air quality, GP access, particularly the north of the borough, Homerton quality accounts are some of the, and the future role of the GP Confederation under new leadership are what we've got so far on the agenda. So with that, I'll close the meeting a few minutes earlier. Thank everyone for their attendance. Thank you.
Thank you.
Thank you.